Cost and quality are challenges for all states and all healthcare delivery systems. In Colorado, what we particularly face is a fragmented healthcare system, which again is not uncommon, but which tends to increase costs. So there's duplication of services. There is lack of coordination between caregivers. There are not smooth handoffs in terms of transition of care. You know, all of those things not only impact costs, but they also impact quality. And for some people, it doesn't make intuitive sense that you can actually increase quality by decreasing cost. But we think it is. Usually you think you have to spend more to get higher quality. In healthcare, it can be just the opposite, that you can actually spend less through coordination of care, and with that get higher quality as well. Okay. For example, Civic, which is a brand new nonprofit formed here in Colorado, is all about creating value in healthcare. That really helps put Colorado ahead of the curve by having an umbrella organization that will be able to coordinate all the efforts throughout the state in increasing quality and hopefully containing costs. It's a dream a little bit to think about decreasing overall costs, but slowing the growth of cost and actually containing costs is certainly a goal we aspire to. Having the conference in Colorado really allows Colorado to play on the national stage of health and healthcare reform. A lot of people don't think of Colorado as a thought leader in health policy, and yet we really are. Colorado is ahead of the curve in many areas, particularly around health information exchange, around healthy living, and even around integrated care at our federally qualified safety net clinics, all of which we think are very important pieces of the future of healthcare in Colorado. So having this symposium here, bringing national leaders in, they always remark about how, isn't this amazing that this symposium is here in Colorado, and how delighted they are to be able to come and not only talk to us about what they know, but learn about all the things that Colorado is doing as well. And I know that I know that our symposium is successful when we have speakers from previous years come back as participants. And that's really what happens year after year. So even if we don't invite a speaker to return to speak, they return to learn. And I think that's a great testimony to the exchange of ideas that happens at the Colorado Health Symposium.